Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
A client is being discharged before complete stabilization of symptoms. When developing a discharge plan for this client, the nurse should ensure that the client will have 1. More medical consultations after discharge. 2. Monthly outpatient visits. 3. Many coordinated services. 4. A caring and supportive family. The correct answer is 3. Many coordinated services are needed, including medication management, more frequent outpatient visits, day treatment, or some combination of these, to decrease the risk of relapse, which is common among chronically ill clients. Medical consultations, if needed, would be included in the coordinated services provided. Chronically mentally ill clients who are discharged early before becoming truly stable typically require more than monthly outpatient visits because of the high risk of relapse. A caring and supportive family is ideal for all clients, but not always available. A 23-year-old client diagnosed with schizophrenia cheerfully announces, "My mom and I are so excited that I'm pregnant. She's willing to help us take care of the baby too." Which of the following reasons should cause the nurse to be concerned about the situation? 1. The client did not say that the father of the baby was excited about this. 2. The mother is not likely to provide enough help for what the client needs. 3. Symptom management will be difficult in early pregnancy without medications. 4. The client will have difficulty financially supporting the baby. The correct answer is 3. Because antipsychotic agents cross the placental barrier and can be teratogenic, they are to be avoided during pregnancy, especially during the first trimester. Later in the pregnancy, low doses of medications may be given if necessary. Although the degree of excitement by the father, the mother's ability to provide help, and the client's financial situation may or may not be a concern. The priority in this situation is the safety of the fetus and risks associated with the need for antipsychotic therapy. The director of a workshop program tells a nurse that the client with schizophrenia had done well for 6 months until last week when a new person started at the workshop. This new person worked faster than the client did and took his place as leader of the group. Based on this information, which of the following interventions is most appropriate? 1. Make a home visit and tell the client that if he does not return to the workshop, he will lose his place there. 2. Ask the director to assign the client to another work group when he returns to the workshop. 3. Make an appointment to meet the client at the mental health center and ask him about the situation. 4. Arrange the placement of the client in a skill training program. The correct answer is 3. The most therapeutic action at this time is for the nurse to make an appointment with the client at the mental health center to explore his feelings and behavior. Doing so acknowledges the client's importance and makes him a partner in resolving the problem. The nurse needs to determine what is going on in the situation first, and then plan accordingly. Threatening the client with loss of position, asking for a new assignment for the client, or arranging for the placement of the client in a skill training program is inappropriate and premature. A nurse working at an outpatient mental health center, primarily with chronically mentally ill clients, receives a telephone call from a mother of a client who lives at home. The mother reports that the client has not been taking her medication and now is refusing to go to the sheltered workshop where she has worked for the past year. What should the nurse do first? 1. Call the director of the workshop for information about the client. 2. Reserve an inpatient bed in preparation for the client's admission. 3. Ask to speak to the client directly on the phone. 4. Make an appointment for the client to see the doctor. The correct answer is 3. The first thing that the nurse should do is to speak with the client on the phone and question her about perceptions or reasons that are interfering with her going to the sheltered workshop. This conveys that the nurse is interested and willing to help the client. The nurse should call the director of the workshop for information only if the nurse receives the client's permission. Making preparations for the client's admission is inappropriate and would not be done until the client's needs have been assessed and it is determined that the client requires hospitalization. Making an appointment with the doctor is inappropriate until the nurse has assessed the client's needs. When working with clients who are experiencing chronic mental illnesses, which of the following should the nurse expect to be generally the least necessary for this client population. 1. Community-based treatment programs. 2. Psychosocial rehabilitation. 3. Employment opportunities. 4. Custodial care in long-term hospitals. The correct answer is 4. During necessary periods of hospitalization, active treatment, rather than custodial care, is needed. Among the more common needs of the chronically mentally ill are community-based treatment programs, psychosocial rehabilitation programs, and employment opportunities. A 22-year-old client is being admitted with a diagnosis of brief psychotic disorder. 2 weeks ago, his girlfriend broke off their engagement and canceled the wedding. Given the Diagnostic and Statistical Manual of Mental Disorders criteria for this disorder, the nurse should expect to find which data during the interview with the client? 1. Current treatment for pneumonia. 2. Regular use of alcohol or marijuana. 3. Evidence of delusions or hallucinations. 4. A history of chronic depression. The correct answer is 3. According to the criteria of the Diagnostic and Statistical Manual of Mental Disorders, a diagnosis of brief psychotic disorder is made when the client exhibits delusions, hallucinations, and disorganized speech or behaviors in the absence of a mood disorder, substance-induced disorder, or general medical condition. During a home visit, the nurse discovers that the client is less verbal, less active, less responsive to directions, severely anxious, and more stuporous. The nurse interprets these findings to indicate that the client needs which of the following? 1. A sleep aid. 2. A clinic appointment. 3. An increase in medication. 4. Immediate medical evaluation. The correct answer is 4. The client is exhibiting symptoms of becoming catatonic and unable to care for himself and needs immediate evaluation and possible hospitalization. A sleep aid is not sufficient to treat this client. The client's worsening condition dictates action without waiting for a clinic appointment. An increase in medication may be indicated, but hospitalization is required first for safety. For the client with catatonic behaviors, which of the following should the nurse use to determine that the medication administered as needed has been most effective in the long term? 1. The client can move all extremities occasionally. 2. The client walks with the nurse to the client's room. 3. The client responds to verbal directions to eat. 4. The client initiates simple activities without directions. The correct answer is 4. Although all the actions indicate improvement, the ability to initiate simple activities without directions indicates the most improvement in the catatonic behaviors. Moving all extremities occasionally, walking with the nurse to the client's room, and responding to verbal directions to eat represent single steps toward the client initiating her own actions. The nurse notes that a client sitting in a chair has not gotten up in 1 hour. The client does not respond to verbal directions, and her arm has been extended over the armrest for 30 minutes. Which of the following should the nurse do next? 1. Assist the client out of the chair to lead her back to bed. 2. Give PRN prescribed doses of haloperidol, Haldol, and lorazepam. 3. Ask the client to describe what she is experiencing right now. 4. Sit quietly with the client until she begins to respond. The correct answer is 2. The client is exhibiting catatonic behavior, an acutely serious result of severe anxiety and psychosis. In this situation, the nurse needs to administer the PRN prescribed doses of haloperidol and lorazepam. They can be given together safely. Assisting the client out of the chair go back to bed, or sitting quietly until the client responds ignores the seriousness of the client's condition. It is unlikely that the client can describe what is being experienced. An outpatient client who has been receiving haloperidol for 2 days develops muscular rigidity, altered consciousness, a temperature of 103 degrees Fahrenheit, and trouble breathing on day 3. The nurse interprets these findings as indicating which of the following? 1. Neuroleptic malignant syndrome. 2. Tardive dyskinesia. 3. Extrapyramidal adverse effects. 4. Drug-induced Parkinsonism. The correct answer is 1. The client is exhibiting hallmark signs and symptoms of life-threatening neuroleptic malignant syndrome induced by the haloperidol. tardive dyskinesia usually occurs later in treatment, typically months to years later. Extrapyramidal adverse effects and drug-induced Parkinsonism, although common, are not life-threatening.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.